What is the Preventive Health Initiative? So the Preventive Health Initiative is a payroll tax incentive program to provide you and your family additional benefits. And so when I say payroll tax incentive, I mean you'll see some changes reflected on your pay stub. But the changes reflected on your pay stub will not reduce your take-home pay in any way. As a matter of fact, it will probably increase. So the Preventive Health Initiative is not only a customized wellness coaching program for you, but it is also going to cover all wellness activities and the majority of the medical expenses that you are using your health insurance for. So if you are not opposed to saving money, having access to better care, and giving the government less money for taxes, which benefits you in every way, then you're gonna love the Preventive Health Initiative. All right, so here's how the Preventive Health Initiative enrollment works. So again, this is an employer-sponsored plan. They've already determined that they want to offer you these benefits, so these additional gifts that you are going to receive, and we're going to walk you through the process of an enrollment. So first things first, there is an open enrollment period. So you all should have received some information from your employer. You will have an employee meeting with us, and we're just gonna basically walk you through an explanation of what benefits you have access to, how to access them, and how it benefits you and your family. Very simply, tax savings covers the cost of the plan. This is the reason that you will see changes reflected to your pay stub. But again, there's a little video explainer and interactive FAQ in your benefits portal. So when you guys sign up, you'll have access to that. And again, this is information that is being provided to you throughout this process for enrollment. So quick little payroll explainer video shows that not only is this not going to take money out of your pocket, it's not going to reduce your take-home pay. As a matter of fact, most of you will get a pay increase because this is a payroll tax incentive for you participating in a wellness plan, and that reduces your tax liability. So reducing your tax liability benefits you in terms of your take-home pay and your tax return at tax time. So keep in mind that although you will see these codes reflected on your pay stub, they are not reducing your take-home pay, and they will never increase your tax liability at the end of the year. Also keep in mind, any questions and resources that you have for this are included in your benefits portal. There's a 24/7 hotline at the bottom of the page, as well as an email outreach for support. Included therein are interactive FAQs, video explainers, and so on. So everything that you need is in your employee benefits portal. So when you get it, make sure that you open it and familiarize yourself with the way that it works. Here's what to expect after enrollment. So we typically get the employee meetings and the processing done during the month that we are in. So let's just say we are in the month of October. We want to try to get everything up and running and completed so that the plan can go live the first of the following month. So whatever month we're in when you watch this video, we assume the plan will go live the first of the following month. But depending on your pay cycle and pay frequency, it might not go live to the 15th of the following month. So keep in mind, you know, in theory, you should access your benefits next month, unless we are at the very end of the month this month and we don't really have time to get through the rest of the process. But, you know, either the 1st or the 15th will be your activation date, and you will be provided an email with the employee benefits portal that I referred to before, and it'll have your instructions on how to log in, how to access your plan, how to access your benefits, and everything will be included there in that email. All right, so let's talk about the benefits that are included. So one of these benefits is wellness coaching, which means you will receive ongoing updates weekly, sometimes a couple of updates per week. You will select either email or text message, whichever vehicle you prefer that we communicate to you with. And yeah, so you get ongoing updates about your care and your benefits and the way that they work. So you will either have selected email or text message, and when you do make those selections, it's because you filled out a little health risk assessment. That's really the only thing we need you to do. When the plan goes live, you'll begin receiving emails. You're gonna have a little 60-second survey. This is your wellness or health risk assessment. You'll answer questions such as age, gender, lifestyle, medications, and conditions. You will then select which platform you want us to communicate with, email or text message, and again, explanation of benefits in the portal. It's going to take you about 5 minutes to get everything set up, and you really only need to do that one time per year. Once you have gotten that completed, you are compliant and you have no concern about being at risk of losing your benefits in the plan. So it's really important. That's the one thing that we need you to do in terms of compliance. When the plan goes live, fill out that little assessment, 60-second digital virtual survey, answer those questions, set up the communication channel, optimize your plan, and then you're good to go. So the benefits that are included in the plan, again, are wellness coaching, so digital therapeutics, telehealth, mental health, virtual urgent care, prescription discounts or free prescriptions and prescription delivery labs. So it's a wellness coaching program, but if the text messages encourage you to do something such as a colonoscopy, mammogram, annual physicals, labs, all of those services are covered, no cost as well. Included therein is also free prescriptions and prescription delivery. We partnered with Amazon. So, I always like to say, when it comes to the mental health component, you can set up a primary and meet with that person weekly outside of work hours, whenever is convenient for you. Mental health can be very expensive, and a lot of people don't do it because it's not easy to access. So why go to the therapist and sit on their couch and pay them when you could sit on your couch and we pay them? Why go to the pharmacy and stand in line and spend your money when we could deliver your scripts no cost the next day? Why go pay for labs and physicals when we'll cover the cost of those? I think an employee who has to get a mammogram every few months because she's in remission from breast cancer, that becomes the most expensive deductible and copay resource that she uses her benefits for. We're now going to cover the cost of that. Okay, so many different benefits and resources, including telehealth, mental health, urgent care for you and everybody in your family, prescription discounts, deliveries, labs, hospital bill eraser, and a big fat life insurance policy. So many additional benefits that your employer has seen fit to sponsor for you. Please make sure that you take advantage of them and at least figure out how they work, because I tell everybody, if you don't hate money or taking care of your family, then this program is very valuable for you. But for some reason, some people just don't pay attention to the benefits that are included. And so that is my challenge to you all. These are very valuable benefits. Just spend 5 minutes on the portal to try to figure them out. Spend 5 minutes getting everything set up so it works for you. And if so, you'll have access to better care for less money across the board, as well as a life insurance policy. So this is a guaranteed issue policy, so you don't have to do labs or physicals to get approved. As long as you are under the age of 70 and well enough to work, you are going to get a plan. And this is whole life, so that means it's portable. So most employers only offer term life insurance, which means if you leave the organization, the plan is terminated, or you can age out. You reach a certain age with term life, the plan is terminated. With our plan, it's permanent. So you live to age 100, we just give you the money, and whether you're employed by this organization or not, when you leave, you can take it with you. So all tremendously valuable benefits included, all funded by this tax incentive. So, please spend a moment to figure them out. That way you don't have questions after enrollment about what's going on. All right, so welcome to the Preventive Health Initiative. We're really grateful that you're here, and we are always here. 1-800 number, email at the bottom of your portal, and all of the content, resources, and FAQs that you would need to understand how to access your benefits and what is included in this package.